So guys, now we shall be discussing regarding the clavipectoral fascia. Very important. Okay, we shall be discussing regarding the clavipectoral fascia, and this clavipectoral fascia is multiple times it has been asked in the exams, guys. Multiple times it has been asked in the exams. Now, now where is this clavipectoral fascia? Clavipectoral fascia is located deep inside the pectoralis major. Okay, I will show you the picture. I'll show you everything whatever I can show you here. Okay, so let us first of all write down what is clavipectoral fascia, and then I'll make you understand what is that. Clavipectoral fascia is located deep to pectoralis major muscle. Deep to pectoralis major muscle. Okay, it is located deep to pectoralis major muscle, and it is filling the space between the clavicle as well as the pectoralis minor, and filling, I'll tell you what is that, filling the space between clavicle and pectoralis minor. Now what do I mean by this? Pectoralis minor. Now what do I mean by this is that, guys, for example, let us say this is your clavicle. Okay, this is your clavicle. Now in front of the clavicle, what muscle do I have? I have got pectoralis major. So this muscle here, this is called as a pectoralis major. Okay, so where is pectoralis major located? In front of the clavicle. See, this is the clavicle over here, this is the clavicle. In front of that we have got this muscle, that is pectoralis major. Now when I'm removing this pectoralis major, inside, deep inside the pectoralis major, right, when I'm removing this, deep inside I have got pectoralis minor. So I will be drawing only those things, guys, only those things. This is the clavicle. What I will be doing is that I will be cutting the clavicle and showing it to you. Let us say this is the clavicle like this. This is your clavicle. And what did I tell you? In front of the clavicle I have got pectoralis major. So in front of the clavicle, in front like this, I have got pectoralis major muscle in front. This muscle here, okay, this muscle here, this is called as pectoralis major muscle in front. And if I remove this pectoralis major, it means, can I tell this is the anterior side of the chest, right, and this is the posterior side of the chest, right? I can tell you that this is the superior and this is the inferior, isn't it? So anteriorly I have got pectoralis major. Now I am removing the pectoralis major, then the next muscle I will find is pectoralis minor. Why it is called minor? Because it is very small. Okay, so this muscle here behind the pectoralis major is called pectoralis minor muscle. And another important thing is that attached to the clavicle, just below the clavicle, what is that muscle which is attached to the inferior surface of the clavicle, guys? That is called as subclavius muscle. It means if this is the clavicle, then inferior to this clavicle there should be a muscle that is attached. This is called subclavius. So shall we write down the names here first? This is called as your pectoralis major muscle, and this is called as your pectoralis minor muscle, and this is called as your subclavius. This is called as your subclavius. Now there is a fascia which is covering the pectoralis major muscle like this. You see, there is a fascia that is covering the pectoralis major. So you call this fascia as, what is this fascia? Pectoralis fascia. Okay, now when you come down, the pectoralis fascia is in continuous with a fold like this. The pectoralis fascia is coming down and it is getting continuous with a dome shaped fold, and this is called as axillary fascia. This is called as axillary fascia. Now important thing is that, let me draw fascia with another color. What is clavipectoral fascia? Okay, now clavipectoral fascia superiorly, what will happen is that, let us say this line which I am drawing, this is called clavipectoral fascia. Okay, clavipectoral. Clavi means clavicle, pectoral means pectoralis minor. Between the clavicle and between pectoralis minor, whatever fascia is there, that is called as clavipectoral fascia. Now this part which I have drawn here, this is called clavipectoral fascia. Superiorly on the top, clavipectoral fascia will enclose your subclavius muscle. Down if you go, clavipectoral fascia will completely enclose your pectoralis minor muscle. And what it is happening? Clavipectoral fascia comes down furthermore, right, covering the pectoralis minor muscle. And after that, it continues downward and joins with, or it completely joins with the axillary fascia. Okay, completely joins with axillary fascia. Okay, now what is clavipectoral fascia? See, this is called as clavipectoral fascia. Clavipectoral fascia. Clavipectoral fascia. So anteriorly clavipectoral fascia is covering the subclavius. Posteriorly, clavipectoral fascia is covering completely the pectoralis minor. Then what is this muscle over here? What is this fascia over here? This is not a fascia. This is called as suspensory ligament of axilla. What is this called as? This is called as suspensory ligament. I mean, even this is also a part of clavipectoral fascia only. So this is called as suspensory ligament of axilla, because it is suspending the pectoralis minor with the axillary fascia, right? Now, this is the entire concept of clavipectoral fascia, but next important thing is what are the structures that are piercing, we will discuss. But so far what you need to know, guys, you have to know that anterior side of the chest or the anterior side of the pectoralis major, you have got this fascia, and this is called as pectoral fascia. This is called as pectoral fascia. Okay, behind pectoral fascia we have got pectoralis muscle. If I remove the pectoralis muscle, I can directly look at pectoralis minor muscle. Okay, now between the clavicle and between the pectoralis minor, whatever muscle, whatever fascia I have, that is called as clavipectoral fascia. That's what I was telling you in the definition as well, that it is deep to pectoralis major. Obviously it is deep to pectoralis major. Next, it is filling the space between clavicle and pectoralis minor. Between the clavicle and between pectoralis minor, whatever space is there, that is filled up by this clavipectoral fascia. Okay, now the important question what they will ask you is that what are the structures that are piercing this clavipectoral fascia? What are the structures that are piercing, guys? So here comes your clavicle. Now you will tell me this is your clavicle. Just below the clavicle, this muscle, whatever is there, this is your, just below the clavicle, this muscle, whatever is there, this is your subclavius. And here you have got your pectoralis minor muscle. Okay, anterior to the clavicle, I have got pectoralis major muscle, like this. Okay, anterior to that, I have got pectoralis fascia, and pectoralis fascia is in continuous with the axillary sheath, like this, right? Axillary fascia, I'm sorry, axillary fascia. So on the top, you have got this fascia here. This is called as clavipectoral fascia. And clavipectoral fascia downward, it continues as suspensory ligament. Now the important thing is that what are the structures that are passing through this? So what are the structures that are passing through this is that there are three important things you have to keep in your mind from now. There is an artery, there is a vein, there is a nerve. Let us say there is an artery here. There is an artery. Okay, so this is an artery, for example. Now the name of this artery will be axillary artery. Axillary artery. Okay, axillary artery will give a branch like this, and this branch completely pierces the clavipectoral fascia. It even pierces your pectoralis major, and then it comes out of the superficial fascia. Now this is called as thoracoacromial artery. What is the name of this artery? The name of this artery, the name of the branch of axillary artery is thoracoacromial artery. Thoracoacromial artery. After that, what did I tell you? We have got a vein. So let us say this is a vein, right? And the name of this vein is, if artery is axillary artery, then the name of the vein will be axillary vein. Yes, this is called as axillary vein. Axillary vein. So axillary vein also will give a branch, and that will pierce your clavipectoral fascia like this. Okay, and the name of this vein is cephalic vein. The name of this vein is cephalic vein, which is a branch of axillary vein. Next, I also told you we have got a nerve, right? So let me draw the nerve over here. Now this is called as lateral cord of brachial plexus. All of you know that in the brachial plexus you have got a medial cord, you have got a lateral cord, right? You have got a posterior cord. So this is called as the lateral cord of brachial plexus. When I will discuss brachial plexus, you will understand. Lateral cord of brachial plexus. Now lateral cord of brachial plexus will give a nerve that is called as lateral pectoral nerve. Why? Because I told you during the nerve supply in the previous lectures on the pectoral region that pectoralis major is supplied by lateral and medial pectoral nerve. So where are they coming from? They are coming from the lateral cord of brachial plexus. So from the lateral cord of brachial plexus you have got a nerve that is coming down all the way and it is piercing the clavipectoral fascia, okay, and it even supplies your the pectoralis major muscle, and obviously the name of this nerve is lateral pectoral nerve. And finally the fourth important thing is the lymphatics, okay. So what are the four important things that are piercing your clavipectoral fascia? The first thing is the artery. What is the artery? Thoracoacromial artery. Vein. What is a vein? Cephalic vein. What is a nerve? Lateral pectoral nerve. And finally I told you lymphatics. So these are the four structures. These are the four structures that are literally piercing your clavipectoral fascia. This is the exam based question, okay. Definitely they're gonna ask you clavipectoral fascia. So this is the important thing which you need to remember for your exam. So this would be more than enough, okay.